Physiology and Injuries in Sports. Class 12, Physical Education. Sports physiology studies how our bodies respond and adapt to physical activity. Muscles, cardiovascular, and nervous systems play key roles in strength and endurance. Regular training improves oxygen uptake, muscle growth, and motor control effectively. Excessive exercise or poor technique can lead to injuries in athletes. Common sports injuries include sprains, strains, bruises, fractures, and dislocations. Overuse, trauma, and poor warm-up are main causes of sports injuries. Prevent injuries with proper conditioning, protective gear, and safe training habits. Initial injury care follows the RICE method: rest, ice, compression, and elevation. Long-term recovery requires rehabilitation to regain strength and mobility after injury. Understanding physiology and injury care helps athletes maximize performance safely.
Understanding physiology and injuries in sports for better fitness. Physical fitness depends on key physiological factors like endurance, strength, and flexibility. Exercise improves muscular system efficiency by increasing strength and muscle endurance. Cardiorespiratory system benefits from exercise with enhanced heart and lung performance. Aging causes natural physiological changes that impact physical performance and recovery. Sports injuries are common and include soft tissue injuries like abrasions and contusions. Lacerations and incisions are types of cuts that affect soft tissue during sports activities. Sprains and strains involve damage to ligaments and muscles, often from sudden movements. Bone injuries include dislocations and several fracture types like green stick and comminuted. Fractures can be transverse, oblique, or impacted, each requiring specific treatment methods. Proper knowledge of physiology and injury types helps in prevention and effective recovery. Understanding skeletal muscles, slow twitch and fast twitch fibers explained. Skeletal muscles consist of two main fiber types, slow twitch and fast twitch fibers. Slow twitch fibers have high mitochondria, myoglobin, and capillaries for endurance. These fibers use aerobic metabolism and are resistant to fatigue for long activities. Slow twitch fibers excel in endurance sports like long-distance running and swimming. Fast twitch fibers contract quickly using glycolytic energy for explosive power. They are ideal for short bursts of power in activities like sprinting and weightlifting. Fiber proportion is genetically determined, but training can improve muscle performance. Endurance training enhances slow twitch fiber efficiency and fatigue resistance. Power training increases fast twitch fiber strength and contraction speed for explosiveness.
Top 5 factors influencing ATP production through cellular respiration. 1. ATP is produced using carbohydrates, fats, and proteins as energy sources. 2. Carbohydrates serve as the primary energy source during aerobic activities. 3. Fats are utilized during prolonged, low-intensity physical activity for energy. 4. Proteins are the least preferred energy source, used when carbs and fats are depleted. 5. Cellular respiration efficiently converts nutrients into usable energy for the body.
Top 5 common soft tissue injuries you should know about. 1. Abrasion is surface skin damage caused by scraping against a rough surface. 2. Contusion is a bruise resulting from blunt force hitting the body. 3. Laceration is an irregular tear in the skin or flesh from trauma. 4. Incision is a clean cut made by a sharp object like a knife. 5. Sprain is an injury to ligaments caused by stretching or tearing. Top 5 bone and joint injuries you should know about. 1. Dislocation occurs when a bone is displaced from its joint, causing severe pain and immobility. 2. Green stick fractures are incomplete breaks, mostly seen in children due to their flexible bones. 3. Comminuted fractures involve the bone shattering into multiple pieces, often from high-impact trauma. 4. Transverse fractures are characterized by a straight horizontal break across the bone shaft. 5. Oblique fractures feature a slanted break, while impacted fractures occur when bone ends are driven into each other.
Top 5 essential facts about metabolism and energy systems in the body. 1. Metabolism is the overall energy transformation process in the human body. 2. Anabolism builds complex molecules from simpler ones, supporting growth and repair. 3. Catabolism breaks down food to release energy for bodily functions. 4. ATP acts as the energy currency, powering cells and metabolic activities. 5. Enzymes regulate metabolic pathways, making reactions efficient and controlled.
Top 5 facts about human energy systems you should know. 1. ATP-CP system powers short bursts under 10 seconds, perfect for jumps and sprints. 2. Anaerobic system fuels activities under 2 minutes, like 200 meters races and intense drills. 3. Aerobic system supports long-duration exercises, ideal for marathons and football games. 4. Each system contributes uniquely to energy supply during different physical activities. 5. Understanding energy systems can improve training and performance in sports.
Top 5 key parameters of cardiorespiratory factor you should know. 1. Cardiorespiratory factor combines respiratory and cardiovascular systems to supply oxygen and nutrients. 2. VO2 max measures the maximum oxygen your body can use during intense exercise, showing fitness level. 3. Blood pressure indicates the force of blood against artery walls, essential for healthy circulation. 4. Blood volume affects how much oxygen-rich blood circulates, influencing endurance and overall health. 5. Oxygen diffusion and extraction ensure muscles get enough oxygen for energy and performance.
Top 5 essential components of physical fitness explained clearly. 1. Strength includes maximum, explosive, and endurance types, supported by fast-twitch muscles and ATP-CP energy. 2. Cardiovascular endurance relies on stroke volume and efficient oxygen delivery for sustained physical activity. 3. Flexibility improves joint range of motion, reducing injury risk and enhancing overall movement quality. 4. Muscular endurance allows muscles to perform repeated contractions over time without fatigue. 5. Body composition balances fat and muscle mass, impacting health and physical performance significantly.
Top 5 facts about endurance you need to know. 1. Endurance is the ability to work for long periods without feeling tired or fatigued. 2. There are 2 main types of endurance, muscular and cardiorespiratory endurance explained. 3. Slow twitch muscle fibers play a key role in developing strong endurance abilities. 4. The aerobic energy system supports endurance by providing energy during prolonged activities. 5. VO2 max and glycogen levels greatly influence how much endurance a person can sustain.
Top 5 facts about speed and flexibility in physical fitness. 1. Speed is the ability to cover a distance in the shortest possible time efficiently. 2. High percentage of fast-twitch muscle fibers significantly enhances speed performance. 3. The ATP-PC energy system fuels quick bursts of speed and power effectively. 4. Rapid nervous stimulation is essential for quick muscle responses and fast movements. 5. Flexibility is the range of motion in joints and muscles, crucial for smooth movement.
Top 5 essential facts about metabolism and energy systems explained. 1. Metabolism is the process your body uses to convert food into energy for daily activities. 2. Anabolism builds complex molecules from simpler ones, helping your body grow and repair. 3. Catabolism breaks down molecules to release energy your body needs to function properly. 4. Your body uses energy systems like ATP to fuel muscles during exercise and rest. 5. Balanced metabolism keeps you healthy by managing energy intake, storage, and usage efficiently.
Top 5 essential facts about your body's 3 main energy systems. 1. The ATP-CP system fuels short bursts under 10 seconds like sprints and jumps. 2. Anaerobic energy powers efforts lasting up to 2 minutes such as 200 meters and 400 meters races. 3. Aerobic system supports long-duration activities like marathons and football games. 4. Each system activates based on exercise duration, providing energy efficiently for performance.
Don't forget to like, share, and subscribe.
Top 5 facts about how your body uses fuel during exercise. 1. Carbohydrates power short, intense workouts as the main energy source for quick bursts. 2. Fats fuel long, low-intensity exercise, providing sustained energy over extended periods. 3. Proteins play a small role, used mainly when carbs and fats are running low. 4. Your body switches fuel sources based on how hard and how long you exercise. 5. Using energy efficiently boosts your performance and helps your body recover faster.
Top 5 facts about ATP, the energy currency of the cell. 1. ATP powers muscle contraction, enabling movement in every part of your body. 2. It transmits nerve signals, allowing fast communication within the nervous system. 3. ATP supports chemical synthesis, helping build essential molecules for life. 4. The ATP-PC system fuels short, intense efforts like hammer throws and push-ups. 5. Energy from ATP is vital for all cellular processes, keeping you alive and active.
Understanding muscle roles in movement for better fitness. Agonists are the primary movers generating specific movement in the body. Antagonists oppose the movement of agonists to control motion and balance. Synergists assist and modify agonist actions for smooth and efficient movement. Stabilizers maintain posture and joint stability during various physical activities. Muscles work together in coordinated roles to produce fluid and controlled motion. Understanding muscle roles helps improve workout effectiveness and prevent injuries. Proper training targets agonists, synergists, and stabilizers for balanced muscle development. Antagonists relax and lengthen to allow agonists to perform their movements efficiently. Stabilizers engage constantly to protect joints and maintain body alignment. Top 5 fascinating facts about myoglobin and mitochondria in muscles. 1. Myoglobin is a red pigment in muscles that stores oxygen for energy production. 2. Mitochondria are organelles that produce energy through cellular respiration in cells. 3. Myoglobin releases oxygen during intense muscle activity to support energy needs. 4. Mitochondria convert oxygen and nutrients into ATP, the cell's main energy source. 5. Together, myoglobin and mitochondria ensure muscles have oxygen and energy to function.
Effective extension activities to boost your fitness components. Improve flexibility with yoga and dynamic stretching routines for better movement. Enhance agility through shuttle runs and ladder drills to increase quickness. Build muscular endurance with circuit training and holding planks consistently. Increase muscular strength using weightlifting and resistance band exercises effectively. Boost speed by practicing sprint intervals and reaction drills regularly. Develop power through medicine ball throws and explosive jump squats. Combine these activities for a balanced and comprehensive fitness improvement plan. Consistency is key to seeing progress in all fitness components over time. Always warm up and cool down to prevent injuries during extension activities.
Effects of exercise on the muscular system, short-term benefits explained. Exercise increases blood flow to muscles, supplying more oxygen and nutrients for energy. Muscle temperature rises during exercise, enhancing enzyme activity and muscle function. Regular movement improves muscle flexibility, allowing a greater range of motion and performance. Exercise boosts mitochondria numbers, increasing muscles' capacity to produce energy efficiently. Muscle size temporarily increases due to swelling from blood flow and small muscle fiber tears. Ligaments and tendons strengthen with repeated exercise, improving joint stability and injury resistance. Lactate builds up in muscles, causing soreness and fatigue after intense exercise sessions. Micro tears in muscle fibers occur during exercise, which repair and lead to muscle growth. Exercise increases metabolism and oxidation, boosting energy turnover and oxygen use in muscles. Muscles store more glycogen and myoglobin, enhancing fuel supply and oxygen transport during activity.
The long-term effects of consistent exercise on your body. Hypertrophy increases muscle fiber thickness and overall muscle size effectively. Strengthening ligaments and tendons reduces injury risk and boosts performance. More and larger mitochondria enhance your muscles' aerobic energy production. Increased myoglobin storage allows more oxygen delivery directly to muscles. Higher glycogen storage provides longer energy availability for endurance activities. Improved oxidation and metabolism lead to better fat burning and energy use. Greater lactate acid tolerance improves endurance and reduces muscle soreness.
Top 5 ways exercise impacts your blood glucose levels. 1. Low to moderate exercises like cycling usually lower blood glucose effectively. 2. High-intensity activities such as sprinting can cause a temporary glucose spike. 3. Weightlifting may increase glucose briefly due to stress hormones released. 4. Longer duration activities tend to stabilize glucose levels over time. 5. Different types and lengths of exercise influence glucose trends uniquely.
Key components of the cardiorespiratory system you should know. The cardiovascular system includes the heart, blood vessels, and blood essential for life. Heart pumps blood, delivering oxygen and nutrients to all body tissues efficiently. Blood vessels transport blood, maintaining temperature and balancing hormones throughout the body. Blood carries oxygen, nutrients, removes waste, and supports immune function continuously. The respiratory system consists of nose, pharynx, larynx, trachea, bronchi, and lungs. Nose filters and moistens air before it travels deeper into the respiratory tract. Pharynx and larynx act as passageways for air moving toward the lungs safely. Trachea and bronchi channel air directly into the lungs for gas exchange. Lungs are responsible for exchanging oxygen and carbon dioxide efficiently with the environment.
Top 5 ways exercise benefits your respiratory system. 1. Exercise improves pulmonary ventilation by increasing the depth and rate of breathing efficiently. 2. It enhances external respiration by boosting oxygen and carbon dioxide exchange in the lungs. 3. Exercise boosts internal respiration, aiding gas exchange between blood and body tissues effectively. 4. It supports oxygen uptake and carbon dioxide removal, optimizing blood gas transport during activity. 5. Regular exercise increases lung capacity and efficiency, strengthening respiratory muscles and endurance.
Top 5 essential facts about the cardiovascular system you must know. 1. The heart pumps blood, supplying oxygen and nutrients to the entire body efficiently. 2. Arteries carry oxygen-rich blood away from the heart to nourish body tissues. 3. Veins return oxygen-poor blood back to the heart for reoxygenation and circulation. 4. Capillaries connect arteries and veins, enabling nutrient and gas exchange in tissues. 5. Blood transports oxygen, nutrients, and removes waste to maintain overall health.
Top 5 fascinating blood type trivia you should know today. 1. O negative is the universal donor, rare and highly sought after in emergencies. 2. O positive is the most common blood type, found in about 37% of people. 3. AB positive is the universal recipient, able to receive any blood type safely. 4. Blood type can influence susceptibility to certain diseases and health conditions. 5. Blood types are inherited from parents and can reveal ancestry and genetic traits.
Top 5 physiological changes that occur due to aging explained. 1. Skin loses elasticity and moisture, causing wrinkles and dryness as collagen production decreases. 2. Muscle mass and strength decline, reducing physical performance and increasing fatigue over time. 3. Bone density decreases, increasing risk of fractures and osteoporosis in older adults. 4. Cognitive functions like memory and processing speed slow down, affecting daily tasks and learning. 5. Cardiovascular efficiency drops, leading to higher blood pressure and reduced oxygen delivery to tissues.
How aging impacts your body systems and functions. Neural function slows down, causing reduced reflexes and coordination in older adults. Muscular strength declines as muscle mass decreases with age, affecting physical performance. Body composition changes include increased fat and decreased lean muscle mass over time. Pulmonary function declines, reducing lung capacity and efficiency in oxygen exchange. Endocrine system experiences hormonal imbalances, leading to slower metabolism and energy changes. Bone mass decreases with age, increasing fragility and risk of fractures in elderly. Cardiovascular function reduces, with decreased heart efficiency and poorer blood circulation. These changes collectively affect mobility, strength, and overall health in aging individuals. Understanding these aging impacts helps in adopting healthier lifestyle choices for longevity. Like
Understanding body composition and bone mass changes after age 60. Body composition includes fat, bone, water, and muscle percentages in the human body. After age 60, total body mass typically decreases while body fat tends to increase. Bone mass measures the mineral content, mainly calcium and phosphorus, in bones. Osteoporosis is common in elderly, especially affecting postmenopausal women significantly. This condition makes bones porous, fragile, and more prone to fractures. Bone mass can decrease by 30 to 50% in individuals after age 60. Maintaining bone health involves proper nutrition, exercise, and medical checkups regularly. Increasing body fat after 60 can impact mobility and overall health negatively. Regular physical activity helps manage body composition and supports bone strength. Healthy lifestyle choices are essential to reduce risks related to aging body changes.
Top 5 Trivia. Do you know these amazing facts about life and nature? 1. Jeanne Calment from France lived 122 years and 164 days, the oldest woman recorded. 2. Jiroman Kimura from Japan lived 116 years and 54 days, the oldest man recorded. 3. Octopuses have 3 hearts and blue blood, making them unique underwater creatures. 4. Bananas are berries, but strawberries are not, defying common fruit classifications. 5. Sharks have been around for over 400 million years, predating dinosaurs by millions.
Understanding athletic and sports injuries, causes and definitions explained. Athletic injury refers to physical damage during practice or competition impacting performance. Sports injury means tissue damage caused by sports or exercise activities. Incorrect movement during sports can lead to various types of injuries. Collisions and aggressive actions like diving or sliding often cause physical injuries. Overtraining without proper rest increases the risk of sustaining sports injuries. Lack of conditioning weakens the body, making athletes prone to injuries. Proper warm-up and technique can help prevent many athletic injuries. Recognizing injury symptoms early ensures timely treatment and faster recovery. Maintaining fitness and strength reduces the chance of sports-related tissue damage.
Classification of sports injuries explained clearly and concisely. Direct injuries occur due to an external force impacting the body at the contact point. Indirect injuries damage soft tissues like ligaments and tendons without external force. Soft tissue injuries involve the skin, muscles, and ligaments, causing pain and swelling. Hard tissue injuries affect bones and cartilage, often requiring medical intervention. Overuse injuries result from repetitive stress, poor technique, or excessive training loads. Preventing sports injuries involves proper warm-up technique and adequate rest periods. Early diagnosis and treatment are crucial to avoid worsening of sports-related injuries. Rehabilitation focuses on restoring function and strength after injury recovery. Understanding injury types helps athletes manage risks and improve performance safely.
Understanding different injury categories and their classifications. Injuries are categorized by the affected body part, soft tissue or hard tissue injuries. Soft tissue injuries involve muscles, ligaments, and tendons, causing pain and swelling. Hard tissue injuries affect bones, such as fractures and breaks requiring medical attention. Minor injuries are less severe and usually heal quickly with basic care at home. Major injuries cause significant damage, often needing urgent medical intervention and recovery. Acute injuries happen suddenly due to trauma or accidents, needing immediate treatment. Chronic injuries develop over time from repetitive strain or overuse without proper rest. Some injuries require professional medical aid to prevent complications and ensure healing. Other injuries are minor enough to manage without medical help using basic care methods. Like understanding different types of skin injuries and their causes. Abrasion occurs when you fall on a rough surface scraping the upper skin layers. Incision is a clean cut caused by a sharp object slicing through the skin. Puncture wound happens when a pointed object pierces the skin deeply. Avulsion involves the skin being torn away from the body forcefully. Proper cleaning of abrasions prevents infection and promotes faster healing. Incision wounds may require stitches to close and heal properly. Puncture wounds need careful cleaning to avoid deep infections. Avulsion injuries often require immediate medical attention for skin repair. Knowing these skin injuries helps you provide better first aid quickly.
Top 5 essential facts about contusions you need to know. 1. A contusion is a bruise caused by a direct blow crushing muscle fibers without breaking skin. 2. The main cause of contusions is a direct impact or collision damaging underlying muscles. 3. Prevent contusions by wearing protective gear like helmets and guards during risky activities. 4. Treat contusions by cleaning wounds, applying compress bandages, and using antibiotics if needed. 5. Monitor contusions for swelling or pain and seek medical help if symptoms worsen.
Top 5 facts about lacerations you need to know. 1. A laceration is a deep cut or tear in the skin or tissue caused by injury. 2. Blunt trauma often causes irregular tears in tissues, leading to complex lacerations. 3. Prevention is key. Always use personal protective gear like eye protection to avoid injuries. 4. Treatment includes cleaning wounds and using pain relief medications like ibuprofen as advised. 5. Care tip. Keep wounds clean, and seek medical help if bleeding or pain worsens. Like
Top 5 most common types of bone injuries you should know. 1. A fracture is a break in the bone, often caused by trauma or stress. 2. A green stick fracture is a partial break where the bone bends, common in children. 3. A compound fracture involves the bone breaking through the skin, causing an open wound. 4. A stress fracture is a small crack in the bone due to repetitive force or overuse. 5. A compression fracture occurs when the bone is crushed, often affecting the spine.
Top 5 most common joint injuries and how they affect you. 1. Sprained ankle occurs when ligaments stretch or tear, causing pain and swelling around the joint. 2. Knee meniscus tear damages cartilage, leading to pain, swelling, and limited knee movement. 3. Shoulder dislocation happens when the upper arm bone pops out of the shoulder socket. 4. Tennis elbow causes pain and inflammation on the outer elbow due to overuse of arm muscles. 5. Arthritis is joint inflammation causing pain, stiffness, and reduced mobility over time. like
Top 5 facts about incisions you should know for safety. 1. An incision is a clean cut into tissue exposing the structures underneath. 2. Common causes include injuries from sharp objects like knives, glass, or razors. 3. Prevent incisions by avoiding sharp edges in your activity and work areas. 4. Treat incisions by washing with soap and water, then drying with a clean towel. 5. Apply a sterile dressing to the incision to protect it and promote healing.
Understanding hard tissue injuries. Dislocation explained clearly. Dislocation occurs when bones at a joint are forced out of their normal position. Complete dislocation means the bones are fully separated at the joint. Partial dislocation, or subluxation, is when bones are only partially displaced. Common causes include trauma, falls, contact sports, and weak muscles or tendons. Symptoms of dislocation include pain, swelling, bruising, and joint instability. Pain is often sharp and worsens with movement of the affected joint. Swelling and bruising around the joint indicate tissue damage from the injury. Joint instability happens when the bones do not stay in their normal position. Treatment options range from medication and rest to manipulation or surgery.
Understanding the 4 main types of bone fractures and their treatments. Stress fractures are small cracks caused by repetitive force and overuse injuries. Poor equipment can increase risk of stress fractures. Low-impact training helps prevent them. Rest, ice, and anti-inflammatory meds aid recovery from stress fractures, typically 6 to 8 weeks. Greenstick fractures occur when a bone bends and cracks, common in children's injuries. Falls cause greenstick fractures. Prevention includes safety gear and a calcium-rich diet. Removable splints are preferred over casting for treating greenstick fractures. Comminuted fractures shatter bones into pieces, often from trauma or violence. Surgical fixation with nails or plates is required for comminuted fractures. Transverse fractures are straight breaks caused by perpendicular force on the bone. Weight-bearing exercise helps prevent transverse fractures. Braces aid in recovery. Understanding dislocation. Causes, symptoms, and effective treatments explained. Dislocation is the abnormal separation of bones at a joint, also known as luxation. Complete dislocation means full separation of joint surfaces, causing severe joint instability. Partial dislocation, or subluxation, is an incomplete displacement of the joint surfaces. Trauma from falls, accidents, and contact sports is a common cause of dislocations. Weak muscles and tendons, especially in the elderly, increase the risk of dislocation. Symptoms include pain, swelling, bruising, instability, loss of movement, and visible deformity. Treatment starts with medication for pain relief and inflammation control. Doctors reposition bones through manipulation to restore proper joint alignment. Rest and immobilization using slings or splints help the joint heal effectively. Rehabilitation with strengthening exercises aids recovery. Surgery is needed if damage is severe. Like, understanding oblique fractures. Causes, prevention, and treatment explained. An oblique fracture is a diagonal break that crosses the bone at an angle. This type of fracture often results from trauma like falls or direct impacts. Common causes include accidents, falls, and other forms of direct physical trauma. Prevent oblique fractures by maintaining regular exercise to strengthen bones and muscles. A diet rich in calcium supports bone health and helps prevent fractures effectively. Treatment varies depending on the severity and location of the fracture. Mild cases may require anti-inflammatory medications to reduce pain and swelling. Severe fractures often need bone reduction, a process to realign the broken bone. Proper medical care and rehabilitation are crucial for full recovery from oblique fractures. Understanding impacted fractures, causes, prevention, and treatment explained. Impacted fractures occur when broken bone ends are jammed together by force. Common causes include falls from height and high-impact trauma events. Prevent impacted fractures with weight-bearing exercises to strengthen bones. Adequate calcium intake supports bone health and helps prevent fractures. Regular physical activity maintains bone density and reduces fracture risk. Treatment involves using a sling or splint to immobilize the fractured bone. Immobilization prevents movement of sharp bone ends, avoiding further injury. Proper care ensures healing and reduces complications from impacted fractures. Follow medical advice closely to recover fully from impacted bone fractures.
Don't forget to like, share, and subscribe.